we've heard all the arguments on both sides of the aisle, from the crazy claims about death panels to misleading warnings about a government takeover of our health care system.
What we're talking about here is insurance companies who chose not to keep the plan that they could have grandfathered.
Insurance companies that chose to strip away benefits from existing plans in the interim, that canceled existing plans in the interim, they took away that grandfathering opportunity. And that's a reality.
But according to the Washington Post, Mr. Carney is not telling the whole truth. Quote, the administration's effort to pin the blame on insurance companies is a classic case of misdirection. Between 75 and 95% of the problem stems from the effective date when Obamacare mandates began. But President Obama knew that would happen, and he actually wants it to happen because it forces Americans into the Obamacare exchanges to get new policies, many of which are more expensive. Remember, the goal of President Obama and the Democratic Party is for the government to control the entire healthcare industry. That's called the single-payer system.
The rollout of the healthcare plan has been a disaster.
And certainly it is. Shouldn't President Obama be upfront about that? And he hasn't been. He's been deceptive.
Well, no.
Shouldn't he say, President Obama, that Dennis Kucinich and I, the president, we're pals. We want a single-payer system where the federal government provides health care for a fee based upon income. And this is what we want, and that's why we're doing the Obamacare thing.
But we've got a lot more people who are going to lose their coverage.
The president promised almost 40 times, if you like your plan, you can keep it, period. Now, contrary to his explicit, quote, guarantee, 4.2 million Americans have found out the president's promise was entirely false. That number, 4.2 million, is expected to triple in coming weeks. And we have reporting that the administration knew this 3 years ago. The White House knew it and debated it internally, according to a Wall Street Journal report, as the president was saying it, but decided it would not sell as well to qualify the president's explicit promises. Tonight, the president, under fire from both sides of the aisle and from millions of angry Americans, tried to explain.
I mean, we're talking about 5% of the population, but that's a significant number of people, even though a whole lot of them are going to be better off. There's going to be a segment who, I've ultimately got to make sure that, I'm speaking to their needs and their concerns. And, I take that very seriously.
10 days ago, he spoke in Boston after the massive waves of cancellations had started. And here was his sentiment back then.
For the vast majority of people who have health insurance that works, you can keep it. For the fewer than 5% of Americans who buy insurance on your own, you will be getting a better deal.
Did you get that? A week ago, those folks were getting a better deal. Now he's taking it very seriously and he's concerned. And then 3 days ago, instead of addressing the fact that his promise, his repeated promise, which was critical to this law's passage in the first place, was entirely false, he instead tried to rewrite his original words. Here he is with his Obama for America supporters.
If you have or had one of these plans before the Affordable Care Act came into law, and you really liked that plan, what we said was you could keep it if it hasn't changed since the law was passed.
Well, of course, that wasn't true. There was never an if or a qualifier on the original promises. In fact, to the contrary, he said period and guaranteed that the people would not lose their plans. And then yesterday, more than a dozen Democratic senators, all of whom voted for the law, all of whom were up for re-election, showed up at the White House begging for help, telling the president he had to do something, anything. And now we get this. Watch.
I feel like you owe these folks an apology for misleading them.
I regret very much that what we intended to do, which is to make sure that everybody is moving into better plans because they want them, as opposed to because they're forced into it, because they're forced into it, because they're forced into it, that, we weren't as clear as we needed to be in terms of the changes that were taking place. Keep in mind that most of the folks who got these cancellation letters, they'll be able to get better care at the same cost or cheaper in these new marketplaces. So the majority of folks will end up being better off, of course, because the website's not working right. They don't necessarily know it right. But even though it's a small percentage of folks who may be disadvantaged, you know, it means a lot to them, and it's scary to them. And I am sorry that they, you know, are finding themselves in this situation based on assurances they got from me.
They withheld that from the American people during an election.
Which assurances were false? I mean, that's the part that was left off, not acknowledged, and has never been acknowledged in the days and weeks since we learned that all these now millions of Americans have been getting canceled. Does it matter? The point is he misled. He gave false information, false assurances repeatedly. Where is the accountability for doing that? Where is the explanation as to how that happened, why that happened?
Now, that, you know, having said that, given that I've been burned already with a website, well, more importantly, the American people have been burned by a website that has been dysfunctional.
He went on again, repeatedly, about the subpar policies, how the vast majority of the policies that are being canceled out there, these 4.2 million people, they were subpar, they were lousy. Is that true?
We're talking about 5% of the population. A lot of these plans are subpar plans, and we put in a clause in the law that said if you had one of those plans, even if it was subpar when the law was passed, you could keep it. But there's enough churn in the market that folks since then have bought subpar plans. You know, I am deeply concerned about it, and I've assigned my team to see what can we do to close some of the holes and gaps in the law, because you know, my intention is to lift up and make sure the insurance that people buy is effective.
The president lied to the American people, and he did so because in all of these statements, or in most of them, he ended with the word period. He made it very clear that you could keep your plan, period. And this attempt to walk it back today, we can't have any more benign ways of saying that the president knowingly lied to the American people when we now find out in 2010 they knew this. Through other analysis, they knew this. In the exemptions they gave, we now find out about another exemption to the unions. They knew this. They removed it. They added an exemption for most of the unions today. So we continually see this playing out where we have an administration that is misleading, and now we have an outright lie.
This has been a disaster for the effective rollout of the overall ACA.
The president in full damage control mode tonight.
I regret very much that we weren't as clear as we needed to be. The majority of folks will end up being better off, of course, because the website's not working right. They don't necessarily know it right. But I am sorry that they you know, are finding themselves in this situation based on assurances they got from me.
This interview, but let's just right now for the upfront just agree that the president was right to actually make an apology, that the president was right to take accountability, and that's the mark of good leadership, and that's the mark of good leadership, and that's the mark of good leadership, and that's the mark of good leadership.
And where was the discussion about when I came out and said almost 40 times, if you like your plan, you can keep it, period?
Megan, 40 times. He was on the campaign trail. You've covered
36 times
campaigns.
before the law was passed.
It was part of the stump. 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 I've been backstage at presidential rallies and gotten bored by hearing the same thing over and over again. That's what happens in the context of a presidential campaign.
Does it not need to be true on time 36 versus time 2?
Of those 40 times, 8 of them were probably in Iowa in different towns on the same day. I mean, look, that was all I'm saying is that you can dramatize what 40 times means, and you can say, well, it was relevant for him to include that in his apologize. It's still on the White House website right now, as he's going out there and telling people that it was wrong. It's on his website. There really were, and there really are in Obamacare, these provisions for grandfathering plans that if you had it before 2010, what the Obama administration neglected to anticipate was that health insurance companies would change the policies on people every year or so, even more frequently than that. Not according to the Wall Street Journal. So that they would get out of.
Not according to the Wall Street Journal. The Wall Street Journal reports that there was an internal debate between the policy people and the political people, and the political people won. They knew that what he was saying was not true, and they decided to have him say it because they thought it was easy.
Maybe some of the political people knew that the insurance companies would do this, and that conversation happened, but The fact is, if you had your plan before 2010, you're grandfathered into the plan. It's just happens to be the case that the insurance companies, in order to duck this provision and jack the rates and jack the premiums on people, some of them, I'm not blaming all insurance companies,
that's not true, Mark.
got out of it this way.
Wait, but listen, that's not true, because Obamacare passed in March of 2010. In June of 2010 is when Kathleen Sebelius changed the regulations such that the president's grandfathering clause, his promise, was completely gutted. And the insurance companies went to the lawmakers and to the White House and said, if you do this with these regulations, almost no one will be grandfathered. It will completely gut any ability to grandfather plans. And Mike Enzi, a Republican senator, went to the floor of the U.S. Senate and said, this must be stopped. She can't do this.
Right.
This completely violates everything that the Democrats promised before this law. And the Democrats accused him of fear-mongering. Every single one of them voted against it. And no one did anything to try to change it between then and now.
We've heard negative stories over and over again. I'll come on every week and talk about the flaws of the rollout, though.
President Obama finally says that he is sorry for promising for years that you could keep your health care plan. No, he didn't. I don't know why we wrote that. That's not true. And then he was asked whether he now has a huge credibility problem.
Do you understand if people are going to be skeptical of the next promise you make, of the next, or are you concerned that people are going to be wondering, geez, what's the fine print that he's not telling me?
I think that I've now been in national public life for 7-8 years. I've been president for almost 5. And I think for the most part, people know that I speak my mind and I tell folks what I think, and I've been very clear about what I'm trying to do.
On this apology, the reason for the apology is that 16 Senate Democrats came to the White House yesterday and raised holy hell because they're afraid they're going to lose their jobs next year in the midterm elections, and the Democrats will lose control of the Senate.
I am sorry that they are finding themselves in this situation based on assurances they got from me. We've got to work hard to make sure that they know we hear them and that we're going to do everything we can to deal with folks who find themselves in a tough position as a consequence of this. My job right now is to make sure that with the assets that we have, we get it done, we get it fixed, and there are going to be some lessons learned.
Lessons learned, and we'll get it fixed. Where have we heard that before?
Tell you that if you've got the IRS operating in anything less than a neutral and nonpartisan way, then that is outrageous. It is contrary to our traditions, and people have to be held accountable, and it's got to be fixed.
And when it comes to this issue, when I say that we are going to find out exactly what happened, everybody will be held accountable.
But no one was held accountable for Benghazi, and no one has been held accountable for the deplorable rollout of Obamacare.
Number one, does it provide greater access to patient care? And number two, does it decrease the overall cost of health care? And on those two measures, they specifically, 50% of them gave it a D or an F.
Some of the people who are most supportive of reform are the very medical professionals who know the health care system best, the doctors and nurses of America. They've seen what happens when their patients can't get the care they need because some insurance company has decided to drop their coverage or water it down. So these doctors know what needs to be fixed about our healthcare system. You are the experts. Nobody has more credibility with the American people on this issue than you do.
Called out today by some news organizations for now, quote, lying about lies, officials at the White House today attempted to clarify the issue. Listen.
I just want to be clear. The president was referring to the law and to the fact that the law was written in a way, and everybody who was closely covered the drafting of that legislation knew it was written about, that the grandfathering clause was in the law. And he was referring to the implementation of that law through the rule process.
Got that?